So, good day, my dear postgraduate students. The class here is Histology for PG's Appendix. Very simple, but it is not for you to identify but to explain to your students because you are a teacher. It has got a circular lumen, sometimes it can be a stellate lumen. And these are all the lymphoid follicles, shaded area, there will be a muscle outside. So I would like you people to enumerate the tubular structures, which can be fallopian tube, the appendix, small blood vessels. The gross picture. I am finding the ascending colon, the cecum into which the ileum comes, the ileocecal junction. And there is a diverticum called the appendix, which has got a blind end. This will be asked as a question for you during the viva or the grossing. The positions of the appendix. I would like you people to kindly go through. So the various parts of the colon, that is beyond my purview, but look at the histology over here. I am not finding villi, but there are multiple crypts which are lined by epithelium as well as the goblet cell variant of the epithelium. And this will be the submucosa and the circular and the longitudinal muscles over here. And the same thing is shown diagrammatically. There is a mucosa. There can be the submucosal plexus of nerves, the myenteric plexus, the inner circular and the outer longitudinal muscles. These ones you people should know by heart. Look at this stellate lumen with the lymphoid follicles. You are a teacher. You should explain this to your students. So look at this glands. They have got the crypts over here, and then there is a muscularis mucosa, a very thin ribbon of muscle. And these yellow structures are all supposed to be the plexus of nerves, submucosal plexus. As I told you, there can be an inner circular, outer longitudinal muscle that is over here, and then a serosa. This is a higher magnification showing the lymphoid follicles, the crypts. And this is again a beautiful diagram. Concentrate on the crypts alone, lined by the goblet cells. The muscularis mucosa is shown over here. The slide is supposed to be a miniature of the gross. Look at the specimen. I am finding an engorged appendix. These are all distended blood vessels, which we call as congestion. So there is edema. And microscopically, this is what we see. So these are all the muscles, and I find irregular nucleated cells are seen through, which we call as transmural inflammation. And the blood vessels are there, which we call congestion. So it is a case of an acute appendicitis. This again is a normal histology. I would like you people to kindly identify these pictures, which are very beautifully shown in this. Thanks to National University of Singapore for the pictures over here. And this incidentally happens to be a parasite, the Enterobius vermicularis. It can be an incidental finding many a time in our slides. So these are all the structures. You will have to look for the Sargentaphene arboreal cells, from which we can get sometimes the carcinoid tumor, which is quite common. So the leader in the sense, there is a band of muscle. 3 muscles will be here, which lead to the appendix. And the same thing is shown over here. It is leading to an edematous acute appendicitis. This I would like you people to describe. It is a specimen for your students. So an acute appendicitis, sometimes it can become black and gangrenous also. As I told you that there can be a transmural, and this fact indicates some kind of a mesoappendicitis. Thank you.